Okay, so I'm going to be talking about Wobbler Syndrome. I'm going to do specifically about dogs. I do think it's seen in also horses, commonly about like the paint horse and quarter horse, but I don't know as much about that, so I'm going to stick with dogs. Okay, so Wobbler Syndrome is a neurologic disease that affects their spine and their neck region. It's characterized by the compression of their spinal cord or nerve roots, which is going to lead to the neurological signs or neck pain. The term itself is used to describe the characteristic like wobbly gait that affected dogs have. It can it's different levels of severity, but it can be very obvious that they have it, or it can only be shown maybe on slippery floors or if the dog's walking slowly. I do have a video here. Last time I tried to put a video in, it didn't work, so I learned my lesson. No, I put it here, but you have to.
Maybe down here, just maybe here, but yeah, no, try it. Maybe that's the secret. Hit that X way up there.
Okay.
Now try.
I'm not the best for this. Oh my gosh. Okay.
Just press yes.
Okay, press yes, see what happens.
There we go.
Okay.
So this is going to be a dog with Wobbler Syndrome. Towards the end, they're going to turn him around, and it's kind of more obvious, but you can see he's walking with a little bit of discomfort. You can see the wobbly gait that they were talking about. I think towards the end, we're going to turn him around. Maybe, we'll see. So especially there, you can see a little uneven walking. And so that's going to be because of the compression of his spinal cord or nerves. So other than the wobbly gait, some other symptoms you could look out for is just basically the weakness or the floating appearance in their front limbs. They could possibly be unable to walk. It's about 5% of all dogs with Wobbler syndrome. It's really in severe cases, but they could also have muscle loss near the shoulders. They could have worn or scuffed toenails from the uneven walking, or increased extension of all four limbs, or the difficulty getting up from the laying position. So as far as diagnosing Wobbler syndrome, the vet's going to go in with an MRI to examine the spinal cord and the disc between the cervical vertebrae. After that, a CT scan can then be used to examine the shape of the bones of the vertebral column. Some cases, they might go in to check, to confirm the diagnosis, and that's when spinal fluid collection can be done or blood tests can be done. Oh, sorry. This is also the MRI showing the spinal compressions where the arrows are. This right there. So as far as the breeds that are most commonly affected, Dobermans and Great Danes are the breeds that you'll see this in most cases. A survey from the Veterinary Medical Database showed that 4.2% of Great Danes have it and 5.5% of Dobermans have it. The Dobermans usually have a classic form of the disease that's only in large dog breeds, whereas the Great Danes have it in giant breeds. If you go on YouTube and you look at some dogs walking around with Wobbler syndrome, it does seem that the Great Dane kind of has more of a severe case. I also believe that it's common for Great Danes to get it at a younger age than Dobermans. But other breeds are just usually the larger breeds, such as the Mastiffs, Weimaraners, German Shepherds, Bernese Mountain Dogs, Swiss Mountain Dogs. But basically any breed can have it, not really the smaller breeds. We found a study of 104 dogs with Wobblers, only 5 of them were small dogs. So as far as treating Wobbler syndrome, you have some non-surgical management you can use, and that's just going to be your anti-inflammatory medications. You can do physical therapies, manipulative therapies such as laser therapy or ultrasound therapy, and then you have your hydrotherapy. Surgical treatment, you can actually do a lot of different things for this, so it's basically what your vet's going to recommend, and that's going to have several factors go into it, such as how severe the symptoms are, or how many lesions are present in the spine, or how severe they are. The most common one is going to be the cervical disc replacement, and I have pictures here of that. So that's where the disc replacement is going to be. I also have a video, which I'm going to have to figure that out again, of the cervical disc replacement.
enlarge the whole thing
Yeah.
too. Might help.
So here you can see where they're going to need to go in and go do the disc replacement, and the compressions there. So what they're going to do is they're going to go in into the cervical vertebrae and basically take them apart. Let's see. They're going to be able to go in there, basically get a space to where they can get the disc replacement. So here they are putting it in, and then they're basically just going to use these parts right here to screw it in right towards the end. So right here they're going to be putting the screws in. And yeah. And then I believe it's just going to like zoom out and say, ah, there it is. So yeah, just a cool little 3D animation I thought would be really helpful.
And you made that, right? That animation?
I did not. I wish I
should have said yes. It
was that. I
impressive.
know. So yeah,
Nice.
and then I have my sources after that.
Okay, let's give her a round of applause.
I wish.
Yeah, exactly. Well, you know, it's always neat to have visuals, and movies are good too. I mean, and you can do that at one place or at two places. Go back to where it's labeled the C, 5, 6, 7. I have a little quiz. What's the vertebra? Where's the mouse? Right
Yeah.
here. What's this one called? Everybody in the room should know the vertebra that's immediately caudal to C7. T1, or T1. Always T1. Because there's only 7. You should know that.
Right.
So the next one, because that's caudal, obviously 5, 6, 7, T1. Okay. If not, we'll move on then. Okay, anybody have any examples, any similar things happen to their dogs? If not, we'll move on. Trying to